So you are here standing, waiting for patients, and a 23-year-old came to you complaining. Hello, doctor. I sometimes get these occasional sensations. I feel like my heart is beating like suddenly, and I can't take my breath, and I feel a little bit dizzy. So, the first thing you do as a physician is connect the dots. You start making sense of the symptoms he is coming with. So, his heart is pumping really fast, so it doesn't have enough time to fill. And so the cardiac output drops. And so the brain doesn't get enough blood, and that's caused dizziness. And the blood accumulates in the lung, causing shortness of breath. So, the question here, why does the heart pump so quickly? Is it an electrical problem? Is it a structural problem? It's probably an electrical problem because it's pumping so fast. So the step here is to take a look at the heart. And because the patient has episodes, so you cannot detect the episode, you have to do a 24-hour ECG. The ECG results came out, and it was normal all along. As you know, it's 24-hour ECG. But during the episodes that the patient came complaining about, it was like this. So what is this? Okay, let's compare, okay? So what is this? A T wave. What is this? A QRS. What is this? Another T wave. What is this? A Q wave. Oh, what is that? This is a tachycardia. Okay, so the question here, what is the source of the tachycardia? Why is the heart beating really quickly? And actually, we have two very general reasons or sources for tachycardia. Cardiologists say it could originate from above the ventricle, or what is known as supraventricular tachycardia. Or it could originate from the ventricles, in which it is called ventricular tachycardia. So how to differentiate between the two? We want to know, why is this heart beating so fast? Is it because there's something above the ventricles that is driving the electricity so fast? Like what? You might ask. We have 5 different causes for supraventricular tachycardia: atrial fibrillation, atrial flutter, multifocal atrial tachycardia, sinus tachycardia, and AVNRT, or atrioventricular nodal reentrant tachycardia. So these are the 5 supraventricular tachycardia causes. How do cardiologists diagnose this tachycardia? How do they know whether it's from above the ventricles or below the ventricles? They use the ECG. In supraventricular tachycardia, you have narrow QRS complex. Electricity comes from the SA node down to the AV node, and then to the His bundle, and then to Purkinje fibers, which means that the 2 ventricles will contract in the same time, which is the normal physiology. But if it's from below, or ventricular tachycardia, it will result in a wide QRS complex, because it takes time for the electrical impulse to travel through the whole 2 ventricles. Okay, so back to our ECG. What do you see? This is a narrow complex, right? Is it wide like in ventricular tachycardia? No, it's narrow. So that means it is a supraventricular tachycardia. That means the origin of electricity that is driving this tachycardia is from above the ventricle. That's very good. This is the first step in identifying why this heart is pumping so fast. So the next step is to identify which of the 5 different supraventricular tachycardia arrhythmias is this. Is it atrial fibrillation, or atrial flutter, or multifocal atrial tachycardia, or is it sinus tachycardia, or is it atrioventricular nodal reentrant tachycardia? So this ECG is a regular tachycardia. It is not atrial fibrillation, because as you see here, this is the shape of atrial fibrillation. There are no P waves like that. And normally AFib is irregular arrhythmia, meaning the intervals between the beats is not regular. But here, in this case, it's regular tachycardia. It is not atrial flutter either, because as you see here, this is the shape of atrial flutter. In AVNRT, there is a re-entry circuit, meaning the electricity comes from above, from the SA node, and it forms like a loop and keeps activating the ventricle to pump, leading to the tachyarrhythmia you see here. And of course, I'll put down in the description some links to explain all these diseases in detail. And the purpose of this video is just seeing how to solve a case like that and how to eliminate answer choices.